All right, now we're going to look at ulcers, specifically peptic ulcers. So what are ulcers? So ulcers are these little sores that can become these huge punctures inside certain regions of your body that can be quite painful, and they can also cause a lot of damage to different body systems. Peptic ulcers usually reside in your GI tract, specifically the esophagus, the stomach, and the small intestine. So we have the esophageal ulcers, you have the peptic ulcers, which reside in the esophagus. We have the gastric ulcers, which you have these peptic ulcers in your stomach. And then you have the intestinal ulcers that usually take place in the duodenum of your small intestine. And what are they? Okay. So there's two really main causes of these sores to develop. One way is through the intake of a lot of these non-steroidal anti-inflammatories. NSAID. So for example, your ibuprofen. So one thing I always ask you whenever you take any kind of medication, so these patients, so we live in a society where when you experience a little bit of pain, people do whatever it takes to get rid of this pain rather than bearing it, so they decide to take pills. One problem with the non-steroidal anti-inflammatories is, before I go into detail, is have you guys ever read the label? So make sure you always read the label of these drugs that you're taking, and what is the warning sign for this patients that take excessive levels of non-steroidal anti-inflammatory drugs? Internal bleeding. So any kind of gastric bleeding that can be due to this problem. So that warning is because of production of ulcers. Non-steroidal anti-inflammatories are inhibitors of these COX enzymes, so COX-1 and COX-2 inhibitors. And so the COX-1 and COX-2 play a big role in development of this molecule called prostaglandin. Prostaglandin is a pro-inflammatory protein, this lipid, that plays a big role in development of creating certain kind of cytokine reactions, but also allow for the development of the mucosal layer of the stomach lining. So the mucosal layer of the stomach. So when you have prostaglandin present, this mucosal layer, that's main function is to do what? Is to protect the stomach from this hydrochloric acid that's present inside of it. So a lot of acid is not a really nice environment for any other tissue. So you need this mucosal layer in the stomach to help protect this. You see this mucosal layer also in the intestine, a little bit of it, and also in the esophagus. However, whenever you have high abundance of this NSAID, non-steroidal anti-inflammatory drugs, this inhibits the COX-1 and COX-2 enzyme, which is required for prostaglandin development. So what happens? This mucosal layer deteriorates, it disappears, and so now this hydrochloric acid is bypassing through the stomach membrane and creating these little sores. These sores are called peptic ulcers. Now, they are very painful. They lead to a lot of gastritis, so inflammation in your gastrointestinal tract. And so a lot of patients, the way they're treated with this would be what? How would you treat someone with these peptic ulcers? One treatment is these proton inhibitors. So these proton inhibitors that are present allow for the inhibition of the stomach in the parietal cells to receive the hydrogens in order to create hydrochloric acid. So what happens to the pH of this situation whenever you give these proton pump inhibitors? So the pH of the stomach goes up, less hydrogen, so the hydrogen concentration goes down, and so the acidity goes down, and so this becomes more alkalinic environment. That's an example of ulcers. Now another type of mechanism is through this bacteria called H. pylori. So H. pylori, so let's put H. pylori here, was this bacteria back around 1982. I think his name was Barry Marshall. Barry Marshall comes up to the committee and says, I found another possible reason for the cause of peptic ulcers. And he explained his case how it was an infection. And so this is probably one of the most hardcore scientists in history, of at least of the 20th and 20th century, where he comes up and says this strain of bacteria will cause this problem. And back and forth, they argued, no, there's not a problem. Again, in most creations usually always have their deniers or haters, as you say. And so he would ask certain volunteers to come in and take this bacteria and demonstrate his hypothesis. No one would, so he decided, okay, you know what, screw it, I'll take it. So he ended up ingesting this H. pylori, and who knew? He developed gastritis, and he developed these peptic ulcers. So H. pylori, then how would you treat someone that has H. pylori, any kind of peptic ulcer? So you would do the same mechanism, so same form of treatment, when we look at H. pylori treatment, but you'd actually add something extra. So the normal treatment would be proton pump inhibitors. So this would decrease the acid production. But for example, here, imagine if these inhibitors don't work. There's another drug that usually these patients receive. What do you think that is? What kind of drug do you think these patients that are infected with H. pylori, that are developing these peptic ulcers because of that, receive? They receive, exactly, antibiotics. Because remember, H. pylori is a bacteria, and antibiotics destroy bacteria. And so he ended up winning the Nobel Prize for this. So even though he was the hardcore scientist ingesting his own theories, because he wants to basically prove everything and no one would really believe him, he ended up winning the Nobel Prize, and screening for H. pylori has now become a standard in the clinic for any kind of instances of peptic ulcers. Another example, another treatment that people use, again, that have, if you, for example, you experience any instances of peptic ulcers, is glutamine. So glutamine is an amino acid that they prescribe sometimes to help the patients recover faster with the help of the proton pump inhibitors.